Welcome Home, a podcast for veterans, about veterans by veterans, is a project of Willing Warriors and the Warrior Retreat at Bull Run.
Good morning. I'm Larry Ziliaks, Director of Culinary Services here at the Warrior Retreat. And today we have a very exciting guest, Dr. Jennifer Cho, who is Deputy Director of the Veterans Administration's Whole Health Program. And we're really excited that she's here to talk to us about this program. I heard her speak to another group that I belong to, and the program really caught my attention, and I was very excited about it. I had not heard about the program before that. Welcome to the Warrior Retreat at Bull Run. Thanks for coming out. If you would, just tell us a little bit about your background and about the program, and we'll go from there.
Okay, thank you. Well, first, Larry, I just want to say thank you for having us out here to the Warrior Retreat and Willing Warriors. It is a beautiful facility. There's a lot of love here. It sounds like a wonderful program. And so I am the Deputy Director of Whole Health at the Washington, D.C. Veterans Affairs Medical Center. I've been with the VA since 2005. I spent over a dozen years in our post-traumatic stress disorders unit as a psychotherapist, and have moved on to whole health, seeing it as kind of the next step as veterans recover from PTSD and other concerns. It's moving beyond, post-traumatic growth into from PTSD to post-traumatic growth and into whole health.
Mm-hmm.
And so in whole health, what we're doing is we are kind of changing the paradigm of healthcare from one where a veteran comes in and it's a fix-it, find-it routine where they might come in for something with their knee, their heart, something, something that's causing them a problem. And the VA will continue to provide them good health care, excellent health care for whatever problems they're coming in for. And we go beyond that, and we're asking veterans for your whole life, right? What matters? And we're looking at not just sick care, but health care and life care. We're really asking veterans, what matters to you, what brings you joy, what is that unique thing that gets you up in the day and makes you want to get out there and live your best life. And so with whole health care, we are inviting veterans to connect with what matters. And then we provide programming that helps them to connect with areas of first mindfulness. So actually knowing, what's going on as it's happening and living life not on autopilot, but with full presence and with full attention and full care. And then we talk to them about different areas of self-care in which they might grow and live more fully. So we might have programming on food and nutrition and how to move your body and how to deepen your relationships, how to grow professionally, how to rest better, and how to actually relax and enjoy your leisure time, how to connect with your spirit and soul, how to connect with your surroundings. There's just so many things that we do in our daily life that make a difference to our healthcare. We know in person's health, coming to your doctor's appointments and doing, what the doctor asks you to is so important. It's only about 20% of what makes a person healthy. Mm-hmm. So there's 80% that has to do with, how you're living your daily life. And we want to make sure that people are connecting with what matters so that they're changing their lifestyles and changing their behaviors so that they're able to live, full, healthy lives and then sit on that proverbial rocking chair and rock on it and look back on their life and go, yeah, that was a life well lived.
So it's preventative in a sense. A lot of it's preventative.
Mm-hmm.
It's open to all former service members.
Mm-hmm.
And is it open to family members?
So it is open to all service members, former service members across all VAs across the nation.
Okay.
And we, depending on what we are offering, we have a caregiver support program in the hospital that has, family members that connect with that.
Right.
And then we also have, different groups that we're looking at about, can we invite family members in? But we do certainly have services that help veterans to improve how they connect with family members. Like we have relationship-focused coaching groups, and our chaplain services has a Warrior to Soulmate program. There's a variety of things that we offer to help former service members connect with their families, because we know, a whole health, it's not just one person, it's like the whole system that you live in, and that matters so much.
Your environment.
Your environment, right? Like, so we had a veteran who their doctor told them they had diabetes, high, hemoglobin A1Cs, and they knew what they were supposed to eat, right? The doctor said, you have to eat this and that to get your, blood sugar down. And the person knew it and didn't do it and didn't do it and didn't do it. And then, and yeah, so many of us has been there, right?
Yeah.
And then what we discovered, right, this veteran connected with one of our health coaches and really sat down, and like the veteran was very motivated to improve in this area of the life. And then with working with the health coach, they realized, well, their family was also hugely important. And they had always been taught, like, you don't turn away food, you eat what mom gives you. This is our culture. This is what we eat. And what they ate wasn't the healthiest thing.
Right.
And so to eat in a healthy way was like, was one value conflicting with another. And so then what we did was we brought in the family and talked about it together and why it was important, what the veteran wanted, which is what the family wanted for him, right, is to become healthy and to, eat the things that lead to a long life, right? And so when bringing on the family and having that conversation, then the family was able to move in that direction together. And the veterans, like, A1Cs came down, started eating healthier because the whole family gathered around what mattered. So
And I see it as a team effort in that sense, because I don't think people realize that somebody who's trying not to drink can't live in a household where everybody's drinking every night. It's the same with trying to quit smoking. But, there's a relative sitting on the other end of the couch having a cigarette. In that kind of environment, survived. And it's the same for food and nutrition as well. If everybody's eating very poorly and it's just ramen noodle after ramen noodle at, over 1,000 milligrams of salt every day, you're all going to get high blood pressure, guaranteed.
Yeah.
So it sounds super valuable to bring the whole family in to help support the veteran in what they need to do to lose weight, or from a mental health standpoint too. It's all connected.
Yeah.
What's the path for a veteran to be involved in the program? What do they have to do?
So any veteran that is enrolled in the DCVA is eligible to be part of our Integrative Health and Wellness Clinic. So all they have to do at this point is talk with their provider, who can be anybody. It doesn't have to be a physician. It can be anybody that can enter a consult in our consult system. And what we're actually working towards is a consult optional model where veterans can actually just self-refer and show a better program and say, I want to be part of Whole Health. And after that, they attend an orientation. We offer orientation 4 days a week, virtual and in person. And at that orientation, they learn about all the different services we offer. We offer 35 to 40 classes a week, scheduled set classes about taking charge of your life and health, and focus group coaching on nutrition, focus group coaching on moving the body or relationships, to drop-in classes where they can just click on a link and be dropped into, say, a yoga class or a meditation class or a acupressure class or Tai Chi. And we're also offering in-person services, massage and acupuncture, and in the new year, meditation classes and coaching and taking charge. And so we have so many things that are offered, and veterans will learn about that in our orientation. And then at the orientation, we put them on our distribution list so that once you are part of Whole Health, we send you a secure message every month to update you on all the new offerings, all the classes. So once you're part of our family, we hold on to you, right? And, because people are busy and they can't always do everything regularly, but we want to make sure that you're still connected, right?
How does a program work in the sense of, okay, I get that they're going to get this message once a month, and it's going to say, hey, we're going to have all these different things that you can do. But is there somebody telling them that they should do this?
Mhm.
They should do acupuncture. They should do massage. They should do this or that. Or is it just left up to them to pick something they might like to do or may help them, may not? How does that work?
Well, that's an excellent question. And so for some of our classes, they are wellness classes. And we actually have a class called Pathfinders, which is exactly what you're talking about, where veterans that they're like, this is what's happening and what would be a nice fit for me. So they can come to Pathfinders, get more in-depth information about each individual offering, and then also have a conversation with a group leader about this is what would be helpful for me, and maybe try out this. And so for some veterans, it's also like, let me try out a few things and see what makes me feel good, what like I really connect with and I'll want to come back with again and again, right? And then we also, another part of our clinic is our integrative medicine clinic, and that is a little more prescribed, where veterans would meet with our integrative nurse practitioner and give a more thorough history of, whatever medical condition they're facing. And these veterans come in a little differently because they are referred by their primary care provider specifically for integrative medicine. So we have our wellness program, and then we have our integrative medicine program. And so once they're referred by their physician into the integrative medicine, then the nurse practitioner will make recommendations on, what's presenting and what different modalities would best help the veteran at that point, and in what order as well.
Right. Okay. Is this available nationwide at all the different VA medical hospitals?
So whole health. So when you asked earlier, well, how do people get into your program, right? So whole health is actually more than a program. It's more than a clinic. It's actually a value, and it's actually whole health is kind of a movement and a value and a way of seeing healthcare that is integrating throughout the VA system. So like we just had a conference on whole health and mental health and whole health and primary care, because it's not just a separate program that people refer to, but it's like in primary care, you might ask, like, what matters to you there? And in mental health, we might ask, well, what matters to you there, right? So that the veteran, wherever they're going, is getting a consistent message of the VA valuing the whole person and not just, what's the matter with you, right? But what matters to you. And so whole health is actually available at every VA across the country. We have, various directives that have come out that says, this is really valuable. And we have research to support this now, right? We know that veterans that are engaged in whole health recover from opioid addiction at much higher rates. We have evidence that veterans that engage in whole health then move on to evidence-based psychotherapies. We have evidence that veterans that are engaged in whole health avoid like back surgeries more. And that they're more engaged in their healthcare and they have better outcomes in various ways. And so whole health is available across all VAs. That said, our program is a pretty robust program. And so, what is available at each site will depend on the individual facility.
So I will say that I received my care at Martinsburg.
Ah, okay.
And the reason I do that is because I live 32 miles from the DC VA or 78 miles from Martinsburg. And it's the same amount of time because of traffic.
Exactly.
So I'd much rather drive. It's a prettier route than 66 in the Beltway. So I'm going to look into it there.
Yeah.
And then get a referral.
Oh, I'm so excited to hear that.
Yeah, for sure.
So you'll join the whole health family.
Yeah, for sure. I guess my question would be to a veteran, why not? Why wouldn't you join this? And when I heard you speak about this program, it just kept rattling around in my brain. Is like, what's wrong? What's the downside here? I don't get it. It just makes no sense to not be involved.
Yeah.
Because you're right. The the VA I started with was radically different than the one today. It was, what's your problem? Oh, we'll try and fix that.
Mhm.
And then, okay, you're fixed. See ya. That was it. And it was just they provided services. I'll tell this story really quickly. No one else has heard this about my first experience with the VA.
Mm.
I had separated. I was living in New Jersey. I went to the VA in Newark, New Jersey, and it's an older hospital. And I was there for hearing, and they said, well, you have to have a hearing test, and then you have to see the doctor. So I have the hearing test, and I go down this long hall, sort of in the basement, and it had a wooden bench that stretched the entire long hall. And then there were offices with a sign out of each office, and it had like a number, like 224-B or something. And I'm looking for this office, and I see these two old guys sitting on the bench. And so I sit down next to them, and these guys look like they'd fought in the Spanish-American War. They were old. They were really so. We're sitting there. There's nobody in the office. Next thing I know, the doctor shows up, and he's older than both of them put together. And he shuffles in, and he then looks at some files. And he starts to call out a name, and he calls out the name Donnell, which is not my last name. And I'm looking at these guys, thinking it's got to be one of them. And they're looking at me, and the doctor's looking at all three of us. And he says, well, obviously they can't hear me. They're deaf. That's why they're here. So he starts screaming the name Donnell. And then it hit me. That's the street I lived on. He was half blind, and looking at my folder, he thought that his street name was my last name. So I went in and I said, the doc, please. Here you go. That's me. Calm down. What do I got to do? And, I got a 0 rating, and they sent me on my way. And I never set foot in a VA after that for, I don't know, 20 years.
Yeah.
Finally, my hearing was so bad that I was hearing, I was thinking I was hearing things that people couldn't possibly have been saying. So I'd be in a professional setting talking to somebody, and I'd swear they said something about monkeys were flying. And that's because my hearing was bad. And then I started to wonder, well, that's obviously I didn't hear the right thing. What was I missing that I thought I heard but wasn't? And I said, that's it. I got to get hearing aids. And I went to the VA, and it was so bad. They said, what color do you want? And so, that was my experience. And once I got in,
Right.
The care is phenomenal,
Yeah.
I think, really. Most of the problems that veterans have are with getting in, and then sometimes with appointments. And
Yeah.
appointments sometimes can be hard to get, but once you get them, the quality of care is supreme.
And I'm glad to hear that. Like I tell veterans, because sometimes we'll see veterans and they're surprised at the quality of care. And I say, well, it's not your dad's VA. It's not your uncle's VA. It's not your grandfather's. It's not even the VA you went to like decades ago, right?
Yeah.
So like the quality of care that we're providing at Whole Health, in Whole Health and across the VA is really at like the forefront of medicine, right? Like things like acupuncture, meditation, and yoga. These are things that you would pay a lot for
Yeah.
in private, like private healthcare doesn't even provide it, right? You have to pay for it out of your own pocket.
Yeah.
And here the VA is saying, here, like welcome, right?
Try this.
Try this.
Hopefully it'll
right?
work.
And it will work, better without addictions for people without pain, right? And so there's not a lot of downside to this, right? And connecting with where the veteran starts makes such a difference, right? Because you and I talked earlier about, veterans and, thoughts of suicide and being disconnected and feeling like, they don't matter or they're not, they're just in a really difficult place, right?
It's the pain. They want the pain to stop.
They want the pain to stop.
Yeah.
Right. And so with Whole Health, we're really starting with where people want to start, right? So like one example might be like we had a veteran who was depressed and, had lost their job and everything was kind of falling apart and like the health was bad relationships. And a lot of times, healthcare might say, well, you should work on this, right? But what we asked was like, well, what matters to you and what do you want to start working on, right? And it turned out like they just wanted to like get through their mail,
Mm-hmm.
right? They just wanted to, like, that pile of mail, like, had gone super high, right? And so they just started, like, opening their mail. And once they did that, they were like, I can do this, right? And then they started doing, like, exercise classes. And then the mood got better. And then, like, you connect with the family. And
Mm-hmm.
so it's starting where the veteran wants to start. And by doing that, then they're able to connect with the healthy aspects of themselves and then connect with their families, connect with, their reason for living in many ways. Like we've had many stories of veterans that, in our mindfulness-based stress reduction class that said, like, I used to think about suicide all the time,
Mm-hmm.
right? Or everything that we had talked about
Yep.
earlier about being disconnected. And then once they attended these classes, they were like, oh, I do matter, right?
Mhm.
And I can enjoy life and I can, live in a way that means something to me,
Yeah.
right? And so that's the beauty of it. It's like, it's a, it's quite a privilege to work in this program.
Yeah.
hmm
What's the best way for a veteran to become involved? Is they sign up online? What are they?
Yeah, they can just talk with their provider and say, I'd like to be referred to Whole Health or in our hospital, the clinic. So again, Whole Health is like a value and one of the VA priorities across the country, right?
Right.
And in our Washington D.C. VA, the clinic is called Integrative Health and Wellness,
Okay.
and so they can just say they want a referral to Integrative Health and Wellness, and then we'll contact them and we'll schedule an orientation. And hopefully sometime in the spring, they can just like call our clinic and or walk in and we can get them. So we're in the process. All the time we're trying to
Sure.
improve and provide better services for our veterans.
Where do you see this program in 3-5 years down the line? What do you hope? Where do you hope it will be?
I hope it will be integrated throughout our hospital, right? And that veterans will get the sense of wherever they are, that it's not just about illness, but about like health, right? And about wellness, and that we are consistently as a hospital, repeating that message to everybody, right? And that we are helping veterans to be healthy, not just themselves, but like in their families and in their communities, and and also that we're connecting with the community, because especially since the VA is such a in the DC area, with the traffic and everything else, right? And we know our veterans live, in such a wide area, that we would also be, helping veterans to connect and find meaning and find purpose and be valued in the communities that they live in and with their families and their relationships and their, workplaces, so that there's a sense of wholeness in their life,
Mm-hmm.
right? And that they feel empowered, and that they are in charge of their lives and feeling like, I know what matters and I'm moving in that direction, right? So whole health is a lot about empowerment and helping people, like veterans, when they're in active duty, right? There's often a mission, right? And when they, are no longer in active duty, sometimes it's like, well, what's the mission now, right? And so it's rediscovering for each unique individual, right? What is their mission? What is their purpose? Because service members are amazing and wonderful. Like when they have a mission, it gets done, right? There's like nothing like that, right? And so if we can help, you know, the veterans discover that from themselves and their lives, as civilians, as former service members,
Mm-hmm.
then they can move forward and we can help support them in the ways that we can. And so the vision really is a community of veterans that are like living their fullest lives, right, in their unique ways and finding their joys and finding their health and feeling engaged and alive. And yeah, so it's just veterans in the community living their best lives.
Yeah. And I don't think people understand how valuable veterans are to the community. And a healthy veteran is much more valuable because then they're in a position to give back to the community, to help in a number of different ways. So it's in the community's interest to have this type of program and have veterans as healthy as they possibly can be. I think of like Team Rubicon. They're out there and they're responding to natural disasters, and they're mostly veterans. And that's the way that they give back, and they're out there because they're healthy. And the healthier our veterans get, the more they can contribute to our communities around the country.
I mean, veterans have often such a value of service, right? That's what they did. They served our country, and they, once they move from being active duty to a veteran, they still many times want to serve. And they feel it very deeply, right? And sometimes it's a sense of like, how do I do this? And I don't know, how to connect with that part of myself. And they have so much to offer, right? And if we could help veterans to connect with that sense of themselves and find ways of helping them to connect with their communities, that would be amazing, right? Like it would really serve the veterans and the community, both at the same time.
Everybody's a winner.
Yeah, everybody. It's a win-win.
Yeah.
It's a win-win for everybody.
For sure. Well, listen, I really appreciate you coming out and taking the time to talk and to tell us about this great program. I encourage all of our listeners, our veteran listeners out there, number one, if you're not registered and receiving care with the VA, I want you to do that right away. Make a claim. Certainly, if you're newly separated from the military, make a claim for everything that you think hurts you. You fell out of a helicopter. You're okay now, but you twisted your knee. It's in your medical records. Make a claim. Make a claim for hearing loss, for all these things. Now, you may get a 0 rating on everything, but now the VA has you in their system. There's a baseline, and I guarantee that what's not hurting you now will hurt you when you're my age. And so you can then make another claim, and you're going to get care and coverage and compensation at a later date, I guarantee you. But the other benefit is that the more veterans that register with the VA for care, the more funding the VA gets, and the more they can help veterans. So really, please register with the VA and then look into the whole health program. Get on board with that, because I think everybody, your family's going to benefit, you're going to benefit, your community's going to benefit, and it just is a no-brainer, really. So get registered, get involved, look into the whole health program, and I guarantee you're going to benefit from it. Doc, thanks for coming out. Really appreciate it. And for our listeners, we'll be back next week with another episode. It drops every morning bright and early for you early risers. You can start listening at 5 a.m. Thanks for listening. We really appreciate it.
Thank you, Larry.
The Welcome Home podcast is brought to you by Willing Warriors, a nonprofit organization serving active duty service members and veterans since 2012. To learn more, please visit our webpage at willingwarriors.org.